So good day, I'm Stephanie Gotas, your nurse in church for today. So for today's assessment, I will be performing the infant's care. So meaning we will do the bathing, the cord care, the feeding, and the burping of the infant. So first, we will be having first the infant's bath. So I have gathered all my equipments here together with my bathtub, baby's clothes, towel, a comb, a thermometer. Let's just assume that this is a thermometer. Cotton balls, a mild soap, and a shampoo. So first, we were going to check the baby's temperature to check if it is normal or not so that we can determine if we were going to push through to the procedure. Okay, so the baby's temperature is 36.9, which is normal. So now let's proceed. So now we're going to undress the baby and wrap the baby using the mummified screen. Okay, since the baby cannot fit in my leg, I will going to demonstrate to you how to do the mummified screen using another teddy bear. So this is how you do the mummified screen. So putting the baby in a mummified screen prevents the baby from unnecessary movement. So after the mummified screen, let's carry the baby in a football manner so that this will put the infants held in a secure place and also giving us the freedom to wash the infant's hair. So now let's proceed to the proper positioning. So our freehand will be used to soak, clean, rinse, and dry the scalp or the head of the baby. We should remember that we should wash the head first if it is the second bath or more of the baby, and we wash the face first if it is her first bath after the delivery. Since this is the baby's first bath, I am going to start with the face first. So first, I'm going to wet my hands and go first to the farther side from the inner canthus to the outer canthus. And I will do the CSC procedure. Then I will wet my hands again and do it on the nearer side. From inner canthus to the outer canthus, wet my hands and do again the CSC pattern. After that, I'm going to wipe the face of the baby to prevent the baby from chilling. Next, I'm going to wash the baby's head. So washing the baby's head, I'm going to use the mild soap. Because mild soap helps prevent from the harmful effect or harmful side effect to the skin of the baby. So now I'm going to wash the baby's head in a circular motion, and I'm going to put my particular attention to the baby's ear. I'm going to fold the baby's ear so that it will prevent the water to enter the ear of the baby. After washing the head of the baby, I'm going to dry the head of the baby in a circular manner to prevent the baby from chilling. After that, we were going to put the baby in the crib and remove the diaper. But in my case, I don't have a crib, so I will just put the baby in the table with a lining. The reason why we remove the diaper of the baby is that we could cleanse the entire body of the baby. So let's just assume that we have removed the diaper of the baby. So now we are going to pick the baby and bring back the baby into the sink. So the head and neck are supported with the palm of the hand. Baby made to sit in the sink so that it prevents the baby from sleeping. So now let's get started to wash the baby. Let's start from the further arm, chest, and abdomen. So now let's soap and rinse the neck to the anterior portion of the baby. So washing this is the utmost important so that we could determine that maybe this is the cause of the irritation or the cause of the infection for the baby. After that, let's position the baby in a prone position, holding the axilla with hand, supporting chest in our forearm. So now we're going to wet the entire back of the baby. Using our free hand, we're going to soak, rinse, wet, and clean the back of the baby. So let's wet the entire back of the baby and soak the nape, the neck, and the back. So using in a circular motion, this is to promote warm effect to the body of the baby. So next, let's soak the further lower extremities, especially the popliteal area. Same with the nearer side or the nearer extremities. So the buttocks and the genital area of the baby is the last to be soaked. So while cleaning the buttocks and the genital area, let's observe the correct direction. Let's just use one stroke. So this is to prevent any irritation or spreading or the contamination. Only just one stroke. So after that, we're going to rinse thoroughly the entire body of the baby. The entire posterior portion of the baby. Okay, we're going to rinse. After rinsing the posterior portion of the body of the baby, we're going to bring back the baby in a supine position and again rinse thoroughly the front part of the baby. After rinsing the body of the baby, let's bring back the baby into the crib. Let's go to pat dry the entire body of the baby using new towel. From the same manner, we're going first to the head, next to the neck, then to the near extremities, lower extremities, also at the back. So now let's put the baby dress. So let's just assume that we have a diaper and we have put a diaper on the baby. So now we're going to wrap the baby with a new clean lei. And comb the baby. now we are done in the infant's bath. So now let's proceed to the cord care of the baby. So now let's proceed to the cord care. So cord care promotes fast healing and drying of the cord, and it also prevents from any infection and any foul odor. So before doing the procedure, we're going to wash our hands. This is to prevent any spread of microorganisms. And as you can see, I have assembled all of my equipments. I have here my 70% alcohol solution, cotton buds, a dropper. Let's just assume that this is a dropper, and a waste receptacle. So first, I'm going to expose the umbilicus stump and cover the genitalia. I'm going to drop a 70% of alcohol solution to the baby's leg. So remember that we use 70% of alcohol solution to ensure the removal of the microorganisms. And then we're going to soak the cotton buds in 70% of alcohol solution. This is to prevent infection. Then we're going to clean it in a circular motion. So take note, when you say circular motion, it is from inner to the outer, or from cleanest to dirtiest. Then discard the used cotton and use another cotton if necessary. And after that, we're going to drop again another 70% of alcohol solution to the umbilicus, avoiding the genitalia. This is to prevent any discomfort to the baby. And then we're going to dry the cord by open dressing. This is to prevent any infection and promote fast healing of the cord. Remember that we're going to remove the cord clamp after 48 hours, and the condition must be there is no redness and there is no drainage. So after this one, we're going to do the aftercare and wash our hands. So now let's proceed to the infant's feeding and burping. So feeding and burping supply infants nourishment and fluid to meet the baby's need. So as you can see, I have gathered my needs for the infant feeding. So we have here our infant bottle with formula and an extra towel. So before doing the procedure, we have to ensure that we have washed our hands. This is to prevent the spread of any microorganisms. So first, before doing the procedure, we have to check the name of the infant in her ringlets and anklets, and also in the baby's bottle. This is to ensure the identity of the baby. So we have here her name tag in her wristlet, and also in the anklet, and also in the baby's formula. So we're good to go. So we're going to wrap the baby warmly and position her in a slight Fowler's position. So this is to prevent the baby from choking. So first, we're going to we have to observe also that we must put an extra towel over our lap or under the buttocks of the baby. This is to prevent the contamination if the baby vomit while we're feeding. So if the baby vomit while feeding, this is just normal. Okay, so we have positioned our baby in a slight Fowler's position. So now we're going to grab the baby's bottle with formula. So we're going to place the nipple of the bottle in the infant's mouth, and we should place the entire nipple with formula. So this is to prevent the baby from gulping a lot of air, which can lead to gas or fuzziness. After feeding, we're going to proceed to the burping. Okay, so take note, while feeding your infant, she might have a wind that she could swallow. This usually happens while you're feeding her or while she is crying. So to get rid of this wind, we burp the infant. And in some cases, this passes winds by the infant's bottom. So in my case, we're going to burp the infant. So there are different kinds of techniques in burping the infant. So for me, I'm going to use the upright position. So I'm going to place my extra towel in my shoulder. This is to prevent the contamination of the baby's vomit. So this is just normal. So we're going to place the baby with my hand supporting her neck and head above my shoulder, and we're going to gently pat or rub the baby's back and wait until the baby burp. So after the baby's burp, we're going to position the baby in a comfortable position and place her in her crib. After doing the procedure, we're going to wash our hands.